But the main thing here is that when I take the judgment out, it's not adding fuel to my emotional fire. That's really the goal with this skill.
Okay, hi everyone, and welcome to the Become Your Own Therapist podcast, the podcast where I try to put myself out of a job as a clinical psychologist. Today we have Sheri Van Dijk in the podcast. She is a social worker who has been working with clients with severe mental health problems since 2000. With extensive experience in a hospital as well as community settings, Sheri now sees clients in private practice and provides consultation and training internationally to other clinicians. Sheri has had extensive training in dialectical behavior therapy and mindfulness, which we're going to be speaking about today, and has been providing DBT-informed therapy to individuals and groups since 2004. In 2010, Sheri was the winner of the R.O. Jones Award for her research on using DBT with bipolar disorder, presented at the Canadian Psychiatric Association conference. Sheri is the author of several books that focus on helping readers learn DBT skills and apply them to a variety of mental health problems, including Calming the Emotional Storm and Don't Let Your Emotions Run Your Life for Teens. In 2013, she published DBT Made Simple, with the aim of making the therapy more accessible both to clients and clinicians. Sheri's newest book, the DBT Workbook for Emotional Relief, will be released in July. Sheri, thank you so much for joining us today.
Thank you for having me, Nevern. Happy to be here.
Okay, great. Yeah, so I'm excited to get into dialectical behavior therapy for the audience because I haven't spoken about it before in the podcast. So I'm sure people are wondering, what's DBT? And then just to have a general discussion about emotions and how to manage one's emotions on a day-to-day basis. So maybe we can start with, if there's anything in the bio about your background that you feel is relevant, you're welcome to introduce that. And maybe you can introduce the idea of dialectical behavior therapy to the listeners.
Yep. So I think you did a good job with the bio. I don't have much to add. I've been doing this work for a long time now, and what I do like to kind of add is that I use DBT with all of my clients. Essentially, I see everybody nowadays through what I refer to as my DBT lens, and I also use the skills myself. I think this is a really helpful thing to emphasize that while the population that I work with typically does have severe mental health problems, the DBT skills are just helpful tools for us to have in managing any kinds of emotions that any human being is going to experience. And of course, the pandemic that we've been going through the last couple of years is a great example, right? When, anxiety gets a little heightened at times, anger levels get up in terms of the disagreements that have been happening versus, with the masks and the anti-maskers and the vaccines and the anti-vaxxers. And there's just been so many dialectical dilemmas, essentially, is how we refer to those, right? The divisions, that these are skills that many people can benefit from using in their day-to-day lives. So in terms of what DBT is, I'll just kind of launch into that. DBT is a type of cognitive behavior therapy. And so I like to let my clients know, many of my clients have been through CBT or cognitive behavior therapy at some point already when they come to me. And so some of the things that you hear about, some of the skills and tools that we use in DBT will sound familiar to you if you're familiar with CBT. But in using CBT, quite often we find that it's just not a great fit. And I mean, like any therapy, no therapy is the one size fits all kind of treatment, right? So quite often people find, especially if they're a more highly sensitive individual, they find that the push for change that's inherent in CBT, the focus on, cognitive distortions and changing the distorted thoughts and that kind of inherent push for change in CBT often can be felt as invalidating. It can be experienced as invalidating. And so for, again, the more highly sensitive clients especially, they need to feel understood and accepted, and they need to work on understanding and accepting themselves before they're ready to go to make that change. So this is where one of the balances comes in DBT. And one of the major changes that was incorporated into CBT when DBT was being developed is that balance of accepting clients as they are, helping them to understand and accept themselves, and then going with that change orientation. Clients come to us because they want to change their lives, of course, right? So we're not saying we're not going to try to help them change, but often we need to step back a little bit and go with that acceptance orientation first. Mm-hmm. So this was one of the major changes when Marsha Linehan, of course, the creator of DBT, and her team started working on creating this treatment back in the late 70s and into the early 80s. So DBT, I started off saying it is a type of cognitive behavior therapy. Some of the skills will sound familiar, and many of the things about DBT are quite different from CBT. I'm not going to make this too long, but I'll just say a little bit about DBT being a full treatment model, because this is something that often gets missed by the general public, but as well as clinicians who know of DBT, but they haven't necessarily been trained in DBT or aren't well informed about what it is. It is a full treatment model in that someone who's attending DBT is attending not just individual psychotherapy once weekly, they're also involved in a skills training group once weekly. So they do individual and group at the same time, which is very unusual for a psychotherapy kind of treatment. They also have access to what we call phone coaching. Used to be called phone coaching. Now it's more generalized as skills coaching. So this can also happen via technology, of course. But this is where somebody has access to a DBT therapist 24 hours a day, 7 days a week in a traditional DBT model to help them generalize the skills that they've been learning in the group skills training. And the DBT therapist, so this is the fourth component of DBT, the DBT therapist is a part of a consultation team, a DBT consultation team that meets and essentially takes a team approach to the clients that are being seen. So each of the DBT therapists involved in the DBT program, the clients that they're seeing aren't just their clients, they are the team's clients. And so this team approach really helps to reduce or even stave off feelings of burnout and feelings of ineffectiveness that can come up for therapists when they're working with really complex and highly suicidal and self-harming clients. And those, of course, are the clients that DBT was created to treat. So initially, it was created to treat clients with borderline personality disorder. And we do see a lot of the high-risk behaviors and so on with that population. Nowadays, of course, we as I mentioned earlier, we treat a lot more than just BPD with this treatment. And we take a more often, not every DBT therapist, but we're often taking a more DBT-informed approach. So, for example, the model that I just described to you, I don't work as part of the DBT model. I provide skills training in individual work, or I use a DBT-informed approach is kind of how I'll describe that to clients. But it's important that people know what they're getting versus what they're not getting. So if we're not providing a full DBT program, it's important for us to kind of educate people about what a DBT model is and what aspects of DBT we are providing.
Great. Yeah, thank you. I asked you a bit of a question that needed elaboration on like many other things before that. So thank you for doing that so succinctly. Okay.
I'm glad it was succinct. Sometimes, I can talk for 2 days about DBT, so sometimes it's hard to stay focused on the task at hand, so to speak. Yeah. Yes.
Yeah. No, I know any of these therapies can be spoken about in a month-long conference, so I think like a few minutes is succinct. Okay, great. Yeah. So. And today, I guess we'll sort of unpack some of these skills and what it means to be a DBT-informed therapist. I invited you on particularly for emotion because I noticed that you've written many self-help books that are geared toward helping people with the emotions in general. And so maybe we can start with, we've covered DBT, but what is, from a DBT perspective, or maybe just from a scientific perspective, what is emotion, and what is the role of emotions from this perspective?
Yeah, great question. There's still actually controversy around, what is an emotion versus, a feeling versus a mood state. Like, there's still ongoing discussion around how we use those terms and what they are exactly. If you look at emotions lists, for example, you can Google, names of emotions or emotions lists, and you'll get different, emotions words or names for emotions. And I always find it interesting how different these lists can be. I remember once looking at an emotion wheel that a client had sent to me to get my feedback. And I was actually appalled to find that the word stupid was on this emotions list. And my DBT brain went, oh my God, that not only is that not an emotion, but it's a judgment. So
it's double whammy.
Exactly. Yeah, so it's really interesting what people think of as emotion. So from a DBT perspective, of course, I'll speak to that. When I talk about an emotion, I'm talking about we call them full system responses. So an emotion is the feeling aspect. So we have that felt aspect to the emotion. What I would just, if I say I feel angry, I'm talking about just that felt sense of anger in my body. So there's also the physical sensations that are associated with the emotion. But if we stick with anger, for example, my heart starts to race when I'm feeling angry, and my muscles might tense, and I might get that body flush as the adrenaline kicks in, right? So those would be some of the physiological responses that happen attached to the emotion. And then there's also the cognitive processes, so the thoughts that we're having. So that's the full system response of an emotion. In DBT, I believe we have 10 basic human emotions that have been identified. I'm not going to list those because, again, it also depends on what therapy you're looking at. Different therapies have different basic emotions that they've identified. But in DBT, there are 10 of them. And there's a lot of work we do around emotions in DBT. One thing that we focus on is actually part of your question there, Nevern, was I think you asked, what's the purpose of emotion? What function do they serve? Yeah. And we talk about the fact that every human emotion serves a purpose. So sometimes they're there to communicate something to us. They're there as messengers, essentially, much of the time, right? We need to kind of pay attention and tune into what they're trying to tell us. Sometimes they're there also to motivate us to take action on something. The fight or flight system is a perfect example here, right? Anxiety or fear, anger, those emotions involve systems in our body being activated that motivate us to action, to either stand and fight in the case of anger, or to flee a situation in the case of fear, typically, right? So every emotion serves a purpose. This often gets confusing for people because, especially nowadays, we've actually been having a lot more conversations about shame, which I think is fantastic. Shame, though, I think sometimes gets a bad rap because, so Brene Brown, I know, has done a lot of fantastic work. I'm not sure if you're familiar with her work, but she's done some great work on shame. And I think the best thing about her work is just that she's starting conversations about it. And when we talk about shame, that actually, often brings about the validating responses we need to help reduce the problematic shame we're experiencing. But I think that shame sometimes gets a bad rap because, like any emotion, from a DBT perspective, it is warranted at some times. So just to give you an example here, shame is warranted when we are afraid, let me back up. Shame is warranted when there's something about ourselves as a person, or when there's a behavior that we have done that could lead us to be rejected by people that we care about, people that are important to us. Okay. So If I give you the example of, I have a young client who, she's a 20-something-year-old young woman who recently, unfortunately, was arrested for driving under the influence. She had had a drink too many, was arrested for driving while impaired, and she felt shame. Shame in this instance is warranted because two factors here. The first thing is shame is going to hopefully prevent her from doing the same behavior again in the future. And because it's warranted, right? If she were to tell some of her friends, family, other people about this behavior she'd done, she probably would actually be rejected by a number of those people. She would be judged for the behavior. It's just not socially acceptable nowadays to drink and drive, right? So shame in that instance is warranted. Now, here's an instance, though, of where we can get into toxic shame or kind of chronic shame. If she lets that keep holding on to her, if she stays stuck in that shame state, obviously that's not going to be helpful in the long run, right? She's learned from her mistake. She's hopefully going to change the behavior, not do it again in future. She's making repair for the behavior by paying the consequences. So we now want that shame to come down. We don't want her to stay stuck in it, because shame can also lead to, thoughts of suicide, major depressive disorder. It can have a lot of long-lasting effects. But this is just a great example of how shame, just like any other emotion, they're all warranted. There are times when we need to feel them and take the messages that they're there to give us, right? But at the same time, we often want to change the emotion because it's not going to help us to just stay stuck in it. Have I answered that question enough, Nevern, around kind of that function of emotion? I've given you some different examples there.
Yes, yeah, that's a great response. And I want to follow a thread there that came up, which was, it either being information, it leading to an action, or it. I think in your book you also mentioned it communicates to other people. Sometimes it can communicate to other people. So, in terms of the first bit there, being able to receive the messages that it's trying to communicate, I often have clients that I'm seeing who they're so out of touch with what they're feeling that it's so difficult to, firstly even know what they're feeling, to be able to acknowledge it, and then to also understand the significance and the meaning and the message that's been sent to the surface. So how is it possible to practice getting in touch with those messages, getting closer, developing your ear to listen to these emotions, and if so, how?
Yeah, that's a great way of putting it, developing your ear to listen to the emotions, right? So, definitely it's possible. It's not at all uncommon for people to have kind of that block, so to speak, right? To not be in touch with their emotions. Think about clients, for example, who use the word upset on a regular basis, right? I think of upset as like a nice generic way of not really addressing the problem, right? Not really paying attention. I'm saying I'm upset, but I don't really have to look too closely at it, right? Or bad also, I feel bad. So people kind of will develop these ways of acknowledging and yet not acknowledging. So when I'm working with somebody, they learn very quickly that they're not allowed to use, they can use the word upset, but I'm going to get them to get a lot more specific. What does that mean to you? It could mean anxious, it could mean angry, it could mean sad, it could mean a lot of different things. So one part to this is in work with people, pinning them down and getting them to be more thoughtful about what they're actually experiencing with the emotion. And so doing that practice in session over time also will translate into their life outside of session, right? For someone who's not coming into therapy necessarily and are just doing this work on their own, just really starting to pay more attention to what is this feeling that I have right now? So I hear the word upset come up. Okay, this is a shortcut I'll give to people sometimes. Instead of upset, are you mad, glad, sad, or afraid? So it's just a nice kind of, often the emotion will fit into one of those four categories. It's a nice shortcut to at least get people started with that process of looking inward a little bit more deeply, right? But mindfulness, of course, is a really big skill that we use here, because we need to develop that capacity to turn inward in that non-judgmental way and focusing on the present moment experience to help us figure out what's going on with that full system response that I talked about earlier, right? So what's the feeling? What are the physical sensations? What are the thoughts going on in my head? And putting all of that information together, we can often get to the name of the emotion. Now, when I'm working with someone in treatment, we actually do this in a more concrete way, and I'll have them fill out some worksheets. If they're really struggling to name emotions, there's a process that I'll take them through to help them practice looking at each of those parts of the emotion, that full system response, and also referring to what I refer to as, I call them reference sheets, emotions reference sheets, where they're basically comparing their response that they're experiencing to these reference sheets to see if they can then figure out, comparing those two things, what emotion is this that I'm feeling? And then we'll talk about that together in session. And, I might kind of question and help them kind of tease apart a little bit, because one of the problems that can come up here, of course, is we often feel multiple emotions at the same time, right? So sometimes that makes it really difficult for people to really identify accurately the emotion that they are experiencing, or emotions, plural. So, it becomes kind of a process. For some people, it's a little easier. Some people already have this skill, of course, well adapted, right? Well honed in terms of naming emotions. But often people don't learn this when they're growing up. I think of this as, it's a whole language of emotions, right? And like any language, it's learnable as we get older. It's usually something that we learn, from infancy. But for some reason, sometimes that language doesn't get taught, or the teaching doesn't get learned. It doesn't get absorbed by the individual. So we can still do it later in life. It just usually means it's a little bit harder to learn that new language as you get older, right? But it's certainly still doable. So through work in session, through practice of mindfulness, and just training in other ways with other skills, slowly, gradually, that person will be able to develop that capacity to hone their emotional language.
Yeah, what I'm hearing a lot of is that adding these terms, being aware of different terms, being nuanced in the language you use, sort of starts to trickle backwards into this like vague experience, and starts to create lines and categories that almost help you, differentiate things in a bit more of a fine-tuned way.
Right. Yeah. And that being able to put the name on it is super important, right? In order to manage emotions. As Dan Siegel, of course, says, if you can't name it, you can't tame it. So this is really the starting point for many clients, is learning to put the accurate name of the emotion on it, so that then they can figure out what to do about it, which often is going to come next, right? With skills to help them manage that emotion.
Yeah, great. I think that's such a useful tip. So would you recommend those sort of emotion wheels or charts and things like that, or do you do it tentatively?
I still haven't found one that I really like, to be honest, Nevern.
Oh gosh.
I should probably just make one myself, but I haven't gotten around to it. I haven't found one that I like, that I completely agree with. There's lots of them out there that, will do, but there's not a specific one that I recommend. What I do recommend, actually, though, is out of Marsha Linehan's manual, of course. Those are actually the reference sheets that I mentioned, the emotions reference sheets. So she put together a really nice series of handouts on each of those 10 emotions that I mentioned as the basic emotions in DBT. And she walks us through what the process of the emotion is like. So what are the physical sensations you might experience? What are the interpretations of a situation that might be going through your head? What are prompting events that might trigger that emotion? So she walks through all of those different components of an emotion. She also gives some different words for the different emotions. Somebody might think, well, I don't feel quite angry, but it feels like anger, but I wouldn't call it angry. So they look at the emotions reference sheet for anger and they see the word resentment, and that fits their experience, right? So it just helps them learn to put that name on. Okay,
great. I want to circle back to something you said earlier about feeling multiple emotions as well.
Right.
So I just want to add a layer of complexity here. So when people are feeling multiple emotions at once, I heard this useful term in your book, the distinction between primary emotions and secondary. I was wondering if you could is there any therapeutic value in that for people who aren't even seeing a therapist?
Definitely, yeah. And actually, before I even go to primary and secondary, I also just want to mention that, of course, there will be some situations where we just feel two primary emotions at once, right? So I might feel, so I'm thinking of a client right now that I've been working with who feels a lot of love and anger towards the same person, and how confusing that's been for her. And that's been something we've been talking about a lot. So emotions can be really confusing that way, because, people might think, well, how can I love someone and even hate them at the same time? Like, not even, beyond the anger I feel, I love them and I hate them. How is this possible? So in that sense, emotions are confusing. But then we throw in the primary and the secondary. So I'll unpack this a little bit. So the primaries, and I know I just mentioned we can have two primaries at the same time, or more than two. The primary emotion, let me also just clarify again, this is, of course, from a DBT perspective, because different therapies also will use these terms differently.
Sure.
From a DBT perspective, the primary emotion is essentially the first responder. It's the first one on the scene. And again, it could be more than one, but for simplicity's sake, I'll just talk about one primary emotion. So if I am having let's say I'm talking with my client, and my client says something, and I notice anger come up in response to what my client has just said. Anger is the primary emotion. It's the first responder. Okay. Now, what happens here is often I will judge myself, or I will have some kind of interpretation of what it means that I'm feeling angry with my client. So if my brain goes to something like this is kind of my typical example here that I use with clients. If my brain goes to, what is wrong with me? I'm feeling angry at my client here, and I'm the therapist. I'm not supposed to get angry at my clients. This is awful, right? Now I'm going to be triggering some secondary emotions for myself. Okay, so the primary emotion is anger. Secondary emotions are how we feel about our feelings. So if I'm judging myself as a bad therapist, I'm saying this is awful. Now I'm maybe feeling angry at myself for feeling angry at my client. So in that instance, anger would be both the primary, and I have more anger as a secondary emotion. So what just happened there is I not only have the initial anger, the primary anger, but now I'm feeling even more angry because I've added anger as a secondary emotion. Or I might feel angry as that primary emotion, and I feel guilt or shame for feeling angry. If I'm thinking I'm an awful therapist, I shouldn't be feeling this way, I might feel more guilt or shame in that instance. So now I still have the primary emotion of anger, and I've added on top of that guilt and shame. So the secondary emotions can not only confuse things and complicate matters, but they also make matters worse typically, because they're just kind of adding more pain to the pain we're already experiencing. Yeah. And that, of course, can get us into what in DBT, this separate bill, but gets us into emotion mind, where it's harder to think straight. It's harder to problem solve and figure out what you can do to help yourself manage those emotions.
So is this why emotional acceptance is so important, so that you're at least not dealing with a two-layered cake of suffering?
You got such a great way with words, Nevern. Yes, I love that. The two-layered cake. Yeah, absolutely. Acceptance is paramount here. And acceptance, not that we're not saying necessarily that we like the emotion, or that we're okay with it, that we're not going to try to do something to reduce the emotion or even eliminate it, right? We're just acknowledging that the emotion is there with acceptance. So yeah, accepting it is what it is. This is how I feel, instead of going down the road of judging it, means no secondary emotions.
Great. Yeah, because I imagine that if I had a lot of emotional acceptance and I felt angry at a client, I imagine that would immediately just stop that chain of dominoes, and I'd just be left with this one piece to
Exactly.
sort of work with.
Yeah. And then we can ask ourselves, okay, now what do I do with this? Is there a problem that I need to solve? Do I need to address what, the client just said to me? Was it hurtful or, inappropriate in some way? Maybe it has nothing to do with the client and it's my own baggage that's coming up, right? In which instance, I still need to be able to, access my internal wisdom to figure out, what do I need to do with this? It's harder to do when we've got secondary emotions in the mix, because they just complicate things.
Yes. Yeah. Okay. So let's say we've got this emotional acceptance. We've been quite reflective about the sort of how we grew up in childhood and how we came to think of I shouldn't feel angry. I should and all of that stuff. And so if we've just got this primary emotion that's come up and we've acknowledged it and we're aware of it, but it's quite overwhelming and it's quite intense. What would a DBT therapist usually recommend in terms of surviving the roller coaster there?
Great question. And the DBT response to that would be, it depends.
Okay.
So of course, it depends on the context of the emotion, right? So there's a lot of different things that could be going on that are contributing to the emotion. So a lot of different skills we might look at. If there's a problem that we can solve that's going to help reduce the intensity of the emotion, then we want to solve the problem. If it's a relational issue, so somebody has said something hurtful to us, maybe we need to draw on our interpersonal effectiveness skills, use some assertiveness skills to address that problem with the individual. Sometimes there isn't anything we can do to reduce the intensity of the pain, and that's where more mindfulness comes in, right? Where we need to learn to sit with that pain and not judge it, which again is going to make it worse. Sometimes, though, we also might use a skill that's called opposite to emotion action. And this is a great skill that can really be helpful in reducing emotional intensity. And the good thing with this skill is you can also use it with any emotion. But if you're familiar with CBT, this is a skill that most of us therapists know as exposure and response prevention when we're working with anxiety. So from that CBT perspective, this is, your client is feeling anxious and the anxiety is causing the urge to avoid or escape a situation. In order to treat that anxiety, we want the person to approach the situation. So if let's say I'm feeling anxious about, let's say I've got social anxiety and I feel anxious about starting group this afternoon. My urge is to avoid going to group. Yeah, you know what? It's not going to help anyways. I'm just going to skip it. Forget about it. So acting opposite would mean approaching the situation and pushing myself to stay in the situation. And over time, with repetition, that's what will help the anxiety come down. That's opposite action. But now we can take that skill of opposite action and use it with any emotion that's coming up. So if I go back to the anger situation with the client that I was describing, if let's say I'm feeling angry with my client because they've said something that I find offensive, and I want to address it with some assertiveness, but I'm finding myself so angry that it's really hard for me to wrap my head around how to respond to the client, right? And no, I'm shortening how I would do this with how I would teach a client this, by the way. I'm leaving out some steps here, but just to kind of get to the point of the skill, what I want to do is act opposite to the anger. So with anger, of course, often we experience urges to get aggressive in some way, either physically or, just argumentative. I might feel the urge to argue back to this client or to say some hurtful things back or whatever. So, of course, acting opposite would mean biting my tongue, using my wise mind to not respond right away. With anger, of course, leaving the situation would be a really helpful opposite action that, again, is recommended in any anger treatment program, right? Get yourself out of that situation. That would be acting opposite. So now I can cool down. Now, the thing is, of course, we need to come back to that situation. We don't want it to turn into avoidance. But the idea here is acting opposite to the anger by biting my tongue, getting myself out of the situation, giving myself time to calm down. Also attached to that would be not judging the person in my mind, because with anger, we often will have the urge not just to lash out verbally, for example, but to judge the person in our thoughts, right? That stupid idiot, I can't believe he just said that, or whatever. We might get really judgy. That will also keep the anger going if we don't work on changing the judgments, which is a whole other skill in DBT. But so through acting opposite, in other words, doing the opposite of what the emotion is telling us to do, we can reduce the intensity of the emotion. The underlying theme here with opposite action is that our emotions love themselves, essentially. And so they create urges in us that get us to keep acting in ways that will strengthen the emotion. So when we know we don't want to strengthen it, we want it to come down in intensity, doing the opposite has the opposite effect and helps to reduce the intensity. So I've I know, given you a whole list of skills there, depending on the situation, different skills you might use to manage it. This is one great thing about DBT, though, too, right? It's a good and a bad. It's great because we have so many options, and it's bad because we have so many options, right? It can be kind of complex when we're working with someone from this perspective, but.
I love it, but I get what you're saying. The paradox of choice it comes into play there. So I want to again circle back to something in there, because there's so much value. But I think I'm going to arbitrarily pick the non-judgment. There toward the emotions and the mindfulness skill. So mindfulness, I mean, for those who are listening, my understanding is that mindfulness is quite a core piece of DBT. And I've engaged in some mindfulness as well. I've been to some retreats and trained in it. And I find the non-judgment can be something that's quite difficult for clients to wrap their mind around, because it can be a bit vague, like what, I'm not judging my emotions. So how do you usually go about explaining something like that, what it means to be non-judgmental?
Yep. So this is actually one of my favorite skills in DBT. It's a very complex skill. It does take a lot of wrapping our heads around this skill. But this is one thing that I love about DBT, is that it takes mindfulness and it breaks it down into smaller steps. So the skill of non-judgmental stance is a core mindfulness skill. And what I do is I like to really personalize this for my client. So I'm hearing, and by the way, welcome to the human race. If you judge a lot, welcome to the human race. We all do this, right? So I like to provide a lot of validation for my client. But when I'm seeing my client, for example, in session, I'm hearing the judgments and I'm seeing them getting activated with emotions, often anger kinds of emotions, by the way, although there could be other emotions in the mix as well, of course. Then that's where I'm going to start going, okay, I need to teach this person non-judgmental stance, and I choose my time to do this. I don't want to do this when they're too activated, by the way, because skills, when we're teaching a new skill, we want to make sure that the client can actually hear it. And so when they're already dysregulated, that's not a good time for new learning to happen, right?
Yeah.
So when when I'm introducing this skill, I like to really connect it for the person, connect the dots, get the rationale, really clear. Do you notice the judgments that you're thinking or that you're saying right now that this person, for example? And do you notice how this is affecting you in your body, in your, the tightness in your muscles? Like, I'll actually point out to them what I'm noticing to help them see that. And then I remind people kind of talk about the fact that I don't expect to make you like this person suddenly or change your opinion about this person. But you can have an opinion about this person in a non-judgmental way so that you will actually be able to feel less emotional intensity, making it more, making the emotions that are there more manageable. So again, connecting this back to that emotion dysregulation, right? When you're already walking around with a lot of emotions, as many of the clients that I work with are, anything that we can do to help reduce the intensity of emotions or to prevent from adding emotions on, I think is worthwhile. So I help my client to understand that connection between the judgmental words that they're using. So, and let me actually back up because I haven't explained what I mean by judgment, right? Judgment is the good, bad, the right, wrong, the stupid, the idiot, the ridiculous. It's most of us have a good sense of that. I'll also refer to it as inflammatory language that we use, right? There is a difference between judgments and evaluations. So some people will say we have to judge at times. And I say, yes, we do, but let's call those evaluations instead of judgments, because there's a distinction here that I make. An evaluation would be something like I'm driving down the road and I'm coming up to a stoplight and it turns yellow. I have to evaluate, is it safe for me to go or do I need to stop? The judgment would be, oh, the stupid light just turned yellow. Okay, so there the judgment is stupid. So there definitely are times where we need to evaluate. We don't need to judge. Judgments are just a short form label that we stick on something. And ideally, when those judgments are creating more emotional pain for us, when we become aware of that, it gives us the choice of, do we want to turn this into a non-judgment or maybe even just let the judgment go? Sometimes that's an option. If I can just let it go, that's kind of the easiest route. I would say that's something that happens less often, especially when there's emotional investment, right? So if I'm emotionally invested in a situation, it's typically going to be harder for me to just let a judgment go and, distract myself or whatever. So often what we want to do is turn a judgment into a non-judgment. Take the short form label out and say the long version of what we really mean instead. And my recipe for that is how I put it is, what are the facts of the situation and what are your feelings? So instead of so if I go back to the situation where I'm with my client and he says something that causes me to feel angry, instead of judging him as mean, for example, so mean in this instance is the judgment, right? He was being mean to me. I want to take that word mean out, because also you don't really know what I mean by mean, right? If I was to say, Nevern, this client, he was so mean to me, you're like, okay, well, what did he do? What does that mean, right? So that's where we want to get more specific. Take the short form out and say the long version. He said something hurtful to me and I felt angry with him. Now you know what I mean by that, right? And so, of course, this is helping me not trigger extra emotional pain. It's also going to go over better in the relationship, with my client. If I say, oh, you're being mean to me, he's not going to know what that means. And that actually might inflame his emotions further, right? So this is also a skill that's helpful in relationships in that way. But the main thing here is that when I take the judgment out, it's not adding fuel to my emotional fire. That's really the goal with this skill. And actually that brings me, I'll just say one more thing about this, that we get stuck in a cycle with this, right? So a judgment typically will come from an emotion that we're feeling. So again, I feel angry at my client. That causes me to judge him. That judgment triggers more emotion, which triggers more judgment, and we get stuck in this cycle, right? The goal here is to interrupt that cycle so that I'm not inflaming the emotion further. It will not typically take the emotion away altogether. Sometimes actually it does, but not usually. Usually the goal is just not to inflame it further so that we can stay in that kind of internal wisdom state to think about how can I deal with this in an effective way, instead of getting into our emotional mind about it and dealing with it ineffectively. How does that, did you have follow-up questions to that, Nevern? Because I know I said a lot there about non-judgmentalness.
Yeah, there's a few doors I could go through here. The one was the one thing that was very helpful there was the difference between evaluation and judgment, because it's necessary to evaluate things, to differentiate between things, and to but the judgment doesn't always seem necessary, and it's almost hard for me to wrap my mind around what that is. What's that extra juice that's been added to evaluation that makes it, boom, a bit more of a judgmental thing, is it? And my mind sort of goes to like having evaluation being putting things on the table and being able to differentiate between these objects, and judgment feels like when that's vertical, you pop that over and suddenly there's a hierarchy, and it's like, I want all of this and none of this at the bottom, more of this, less of this. So it's sort of like and I want to ask in terms of, well, you were speaking about how the situation and the emotion can be changed by the non-judgment, like the experience of it can be changed. And I was wondering if when people practice non-judgment toward the emotions, is it does the quality of the way the emotion is experienced over time, with this practice, does it change in some way? And if that doesn't change, is there anything that you've seen in your clinical work or research or over time where if someone takes this seriously, this practice of non-judgment, you've seen something in their lives or in their being change?
Yeah, and I won't speak specifically to non-judgment because there's a lot of ways in DBT that we practice acceptance. So non-judgmentalness, mindfulness, radical acceptance, self-validation. So there's a lot of skills that have that non-judgmental accepting component to them, right? Okay. So generally with the practice of those skills, what I typically see is a reduction in the intensity of emotions, usually. That, when people are more accepting kind of across the board of emotions of themselves, of others, of situations in the world, they just don't suffer as much as they were suffering before. So for some people that might mean, again, if it's an anger management problem, the anger in general comes down. Or for people with major depressive disorder, their mood, they don't necessarily fully, entirely recover for the rest of their lives, but they're more able to manage the depression at the very least, and so that the mood isn't as depressed, or they're less anxious in the case of an anxiety disorder. So typically, that's my experience, is the suffering really reduces.
Wow. Okay. That's quite amazing and quite hopeful. There's like a hopeful message in that exactly. It's not just, we're not just doing collateral damage almost here, in trying to just reduce anything further bad from happening, or let's just not have additional bad feelings here, but actually that the quality of your experience can change over time with acceptance.
And healing is the word that comes to mind, right? Is that people heal with the skills. Yeah. Now, and let me be clear too. I mean, when there is trauma in people's backgrounds, as there often is, there's often additional work that needs to be done in terms of trauma processing and those kinds of things. But in terms of healing, to get people to the point of being able to do trauma processing, for example, DBT is a wonderful first step. And for many people, that's, the only step that they need. Right. So they heal from whatever those traumas were, at least well enough or entirely to be able to live that life worth living that they've been aiming for.
Yeah. Great. Yeah, I think that's in respect, I see we're almost out of time. So in respect of your time and your schedule and things, I want to ask you a final question, and then I'll ask you about where people can find you and your work.
Sure.
But I think my final question is, what do you know about DBT and the skills and just anything in the literature that you think people ought to know, just in the way that our society is currently structured? What do you wish people knew?
That's a broad question, and the thing that just comes to mind is that DBT, again, while it was created to treat borderline personality disorder, it is really mind-blowing the amount of research that has been done on DBT to treat other conditions, other problems in living even. So the versatility of DBT, I guess, is what I'm getting at here. A lot of clinicians still have the blinders on about DBT is for borderline personality disorder. And, I get a lot of clinicians who will contact me, with referrals for their clients with borderline personality disorder still. It's not just about BPD. It is, I have a list actually that I add to periodically for workshops that I do. And it used to be called DBT for disorders other than BPD, and I had a list of research studies, and I had to rename the handout because there were things on this list that don't involve conditions or diagnoses anymore, like DBT being used for family members or caregivers of people with certain conditions, like dementia, like BPD, so these aren't people with a mental health problem themselves. They're caring for someone with the mental health problem.
Yeah.
Breast cancer survivors, adolescents with chronic kidney failure. There's all sorts of things that I've been adding to on this list over the years that essentially, it's about general emotion dysregulation. And the thing is, who does not experience emotion dysregulation at times in some form, right? Whether it's somebody in your life dies and you've got that intense grief, or the, war, even if it's halfway across the world, or it's in your backyard that you're dealing with. And, using skills to help reduce your anxiety, your fear, and of course, safety, right? But, again, the pandemic has been a huge example as well, where everybody gets dysregulated at times. Whatever, dysregulation, of course, is going to look different for different people too. I don't want people to think that, they never get dysregulated because they don't have that stereotypical meltdown, right? Dysregulation can also be stuffing emotions inward and suffering silently, so to speak, right? So everybody experiences dysregulation. DBT was created to help people manage dysregulated emotions, essentially. So it only makes sense that we can bring this treatment to bear. And I was going to say with other conditions, but again, in our own lives and for clients who aren't necessarily suffering with a mental health diagnosis or illness, right? Hope that answers your question, Nevern.
Yes, yeah, it does. Yeah. And I think if I ever met someone who was never emotionally dysregulated, I'd think they're, from another planet or something like that. Yeah.
Or AI, right? They're a robot. Yeah, definitely.
Yes. Yes, exactly. We need to get our DBT skills down before the AI take over. So
exactly.
Yeah, thanks so much for coming on, Sheri. It's been lovely to speak to you. Thank you for the influx of skills and wisdom, and just for making time.
Yeah, my pleasure, Nevern. Thank you again for having me.
Okay, great. Where can people find out a bit more about you or your work? Would you point them in specific directions?
Yep. So I do have a website. It's Sheri Van Dijk. Sorry, I'm giving you my email address. It's www.sherivandijk.com. Okay. And I do provide workshops and webinars. I do consultation for other clinicians and so on as well. Yeah. And all of my books are listed on my website. They're also available through online bookstores like Amazon.
Okay. Great. I hope you have a non-judgmental day. And yeah.
Thank you, Nevern. And I wish you skillful means.
Great. Thanks.